Hi everyone, Msao Agi as usual. Guys, okay, my dear viewers, I posed the question up there and I also posed another question down here. Is it okay? So to begin with the first question, why do you think most of the health workers hide their identity? Why? As a practicing health personnel, I've seen it, I've witnessed it. Health workers hide their identity. You see, when it comes to maternity and you're taking history from the mother, and the mother is either midwife, a nurse, any name it. You ask about the job, about the occupation, they'll always give you a housewife. Me, I always dig deeper in almost everyone who gives me an occupation as a housewife. I'll always find out most of them, they are health workers. Their occupation, they are housewives. Why do we hide our identity? This question now down here. I'm wondering, why don't we give adequate care to the people who disclose their occupation as health personnel? It's also my question. So you may find that this second question is the right answer to the upper question. I'm one of the people who do not hide my identity. Whether I'm wherever I go, especially maybe in the taxi and those public places where they have not called me to give a speech, but call me to give a speech, my name, my occupation, like my job, it's always at my fingertip. But I'm saying this, why do we end up administering treatment to our own patients once we have disclosed our status? Because you people, you've always told us after treating, you're like, you'll get the next treatment at 8. Then I'm like, excuse me, it's already like 10 minutes past 8. My patient hasn't gotten treatment. Someone tells you, it's okay. But since you disclosed, I think you can help me and do administer. But is that real also, okay? Am I supposed to administer treatment to my own patient? But for the sake of timing and half-life of the medicine, we end up administering those treatments. Sometimes, hey, I will not disclose the hospital, but you might end up administering your own treatment. Yes, I'm not here to disclose places, but if you know you're doing it, please check yourselves. I doubt if being a medical worker puts me in the right position to administer most of the things, almost all, to my own patient, just because you've known that I'm a healthy worker. I also work somewhere. I'm not working in that hospital where I've brought my patient or where my patient has come to seek medical attention. But someone gives you the whole tray. Please assist as I work on these ones. What if I wasn't a healthy worker? Who was going to administer that treatment? That means my patient would be missing. And that gives me a clue that it could be most of the people do miss their treatment because some will not even know at what time they are supposed to receive. You administer a drug which is supposed to be given 3 times a day, someone gets 1 dose. Or someone gets 2 doses, they don't know whether they are supposed to receive another treatment. But all in all, God answers it all. That's my happiness. Munange, they end up getting better, whether they received once, whether they received twice, whether they did not receive at all in a day. Hey, you see them moving and they catch up and they get better. I think by the use of their own body and nutrition and those other things. That's why when you're sick, guys, nutrition must be number 1. Nutrition, I mean feeding. Check what you're feeding. Is it of a health value? Because it is going to give you the highest percentage in your healing process. Thank you for watching me. Bye-bye.